Katie with Hill Country Hands. Thank you for joining me on my channel today. This is week 33 of my pregnancy for me. This is my weekly update on how I'm doing with hyperemesis and the PICCLINE. I'm going to try to make today's video update quick because I wanted to go over a couple tips, tricks, just info on my PICC that I wish that I would have known before I got one, or like right when I first got one. I had a lot of questions, about it. So I feel like I'm going to share some information that I thought would maybe be helpful if you are getting a PICC or planning to, or seeing if that's a good option for you, or you've just gotten one. Since I've had a PICC for going on about 5 months now, I've kind of gotten through some things, know kind of some tips and tricks that have worked for me, and I'm going to talk about that the second part of this video, and I'm actually going to show y'all what my PICCLINE looks like with the sutures. So if that's not something that you want to watch, I understand. It's not like the prettiest thing. So if you're easily grossed out, watch the first half and don't watch whenever I go over and show y'all my PICC. So week 33 for me has been about the same. Still really nauseous, still vomiting. We're still doing the Phenergan every couple hours, the fourth dose to half dose. I still have the Zofran pump going 24/7 at that highest dose. So it helps, but it doesn't take it all the way away. I'm pretty much nauseous still all the time. There's just times that it's worse, and then there's times that I still can't keep liquids or food down. Still feeling really dizzy. My blood pressure's been still on the low side. So getting the fluids and me just trying to increase my fluid intake definitely helps with the dizziness some, but it doesn't take it all the way away. And I'm still having a lot of Braxton Hicks. They have been more intense and more frequent, which kind of worries me a little bit. I just don't want baby to come too early. I want them to stay in there just a little bit longer. I'm trying to just listen to my body and take it easy and not overdo it. And Braxton Hicks is a normal way that your body prepares for labor. So as long as I don't start having like full-on contractions or my water breaks or anything like that, I think we're okay. Emotionally, I think I'm doing better the last couple weeks just because I know that we are towards the end of the pregnancy. I have at most 6 weeks left, less if they come sooner. So I think just knowing that there's a closer end in sight at this point, I feel better. And then I joined a little support group on Facebook for hyperemesis, and I asked a bunch of women their experience, like if they felt better right after the delivery or not, because I've been worried about that, because I know you can have residual hormones, and some people have had to keep their PICCs up to 6 weeks postpartum, and I really hope that doesn't happen to me. I felt much better after talking to some of the women on there. The majority said that they felt better after the placenta and the baby was out, that within like hours or a day they felt amazing. And I mean, you have other pains from going through labor and stuff like that, but that the hyperemesis symptoms were gone. So there were only a few that said that they weren't, and those few said that they're having to go to like a GI specialist because they have, I guess they kind of have like permanent damage from the hyperemesis because they were sick for so long and so sick. So it made me feel better that most women were better shortly after the delivery. So I'm really hoping that happens for us so that we can just enjoy baby number 2 and I can get back to feeling more like myself. And I still just feel like everything with the delivery is hopefully going to work out. Things seem to be getting, I don't know, maybe a little bit better out there. So I'm hoping that, we don't have to worry about my husband not being present at the delivery. I'm still not planning on like being able to have any other visitors or have Mackenzie come. If that rule is changed by then, that'll be great. But if it's not, like, I'm okay with it. So all in all, week 33 has been a good week. Baby's kicking a lot. Like I said, Braxton Hicks a lot. And then just my typical hyperemesis stuff that I've been feeling for the past few months. we have a doctor's appointment next Tuesday, so as far as I know, we still have to wear a mask, or I still have to wear a mask, and then Justin can't come. He has to sit in the car. So hopefully that goes good. And then I think after this appointment on Tuesday, I think we go to every week. I think it'll be every weekly appointments at that point. So now I'm going to go over a couple of things on the Picc before I start that, in case I lose some of the viewers. In case I lose you midway, if you don't want to look at my Picc. Please subscribe. My goal for May is to reach 150 subscribers. I know we're still a week away from May. I'm still planning on doing something a little bit different in May, the beginning of May, that I will fill y'all in on probably this week. And just please subscribe, tell your friends if you like my channel. I'm trying really hard to grow the channel. I definitely want viewers that enjoy my videos though, and my content. So if you're watching, I really appreciate it more than you know. I do new videos every Tuesday and Thursday, so if you hit the little notification button, that lets you know whenever I have posted a new video. Also, I didn't know a whole lot about YouTube whenever I first started watching. It doesn't cost you any money. It doesn't do anything for you to subscribe. It just helps me out. It shows YouTube that people like my content, and it just helps grow my channel. So if you can just subscribe for me, I'd really appreciate it. It just takes a second just to hit that subscribe button. So now I'm gonna go over some stuff with the Picc real quick. First, I wanted to show y'all the meds that I'm on. So this is what the Zofran bag looks like. So it's attached to this tubing. It has a filter, and then I have a pump in here for the Zofran. So here's the pump. It's pretty easy to use, and then it just connects to the bag. And then as the bag gets lower, I just keep kind of folding it over so it doesn't get air bubbles. We have to change the bag every 70 hours, I think. Depends on how fast your meds are running and what dose you're at and everything. But so one of my bags will last a couple of days. So Justin does it for me. And then if we're gonna change the tubing, I obviously can't do that by myself because you have to change it from all the way up here. And we usually change the tubing every other time. So we change the tubing twice a week. So some days it's easier, and he just has to pull this off and put it on, and then retype into the little pump saying that we put in a new bag, so here's how many hours and how many mLs it is and everything. But if he has to change the tubing, it's a little bit more of a process because you have to prime it and let it go through and change the filter and all that, so it takes a little bit. But this is just what the Zofran looks like. It does have to be kept in the fridge, and it's supposed to be in this bag, a dark bag, to protect it from light. And that gets delivered, all this stuff gets delivered to me once a week. Other thing that I take is this. They added back in probably February. They added it a little bit later on. One of the home health nurses had suggested it just because I have had hyperemesis for a while, and he didn't want me to get any kind of damage from acid. And it has helped. It doesn't help my nausea, but it does help with reflux and TMI, but whenever I throw up, it's not as much stomach acid type stuff. So it does help. It's this pantoprazole, I can't ever say it. So it comes in these little vials, and it's powder. I take one of these a day. Justin gives it to me in the morning. So you have to get a needle. It comes with needles, and then you just open the flush. So you put the needle on, and then you put the flush into this. You just push it in and then shake it up, and then you draw it back with the needle, and then the needle comes off, and then that part goes onto this little port that's capped, and then you just give it slowly. So we do that every day, and that I think is helping just with the stomach acid stuff. And then the other thing that I take is the promethazine. So it comes in a little box like this, and there's 25 in here, and then they come just like in these little vials. So same thing that we did with like the other one, you take the needle. For this one though, you get rid of 1 ml so it has room. So you like shoot out the 1 ml down to 9, and then you pull back that 1 ml that's in here. And then I usually do a 4th dose every hour to 2 hours. Full doses just make me feel way too out of it, and I start like almost having a panic attack. It makes me really anxious. So unless I'm really sick, we don't do a full dose. And the 4th dose, I'm able to function and still take care of Mackenzie. Justin will usually give me a half dose before bed, just so that I feel better for longer, so I don't have to give it to myself in the middle of the night. I still do sometimes. So those are the meds that I'm on. Then we do fluids as well. For the fluids, they come like this. We use the Dilaflow, so I don't have an extra pump for the fluids. They offered to send me one, but I would just rather use the Dilaflow and not have 2 pumps to like carry around, and I only get fluids like once a day at most. It's usually every other day. So it goes into this little thing. You just like puncture it and then you hang it up. I do have an IV pole, which is nice. If I want to wheel it into the bathroom, I can. I know some people don't get IV poles, so I mean, you just have to hang it or put up a nail or something on the wall so that it can hang, because with the Dilaflow, it uses gravity. So there's a bunch of different numbers you can set like the flow on here. We just set it to open, so it goes as fast as it can. It usually takes a couple hours. So it will go on this one, and then I'll still keep my other port with the Zofran. So I do have to have help doing that because I can't reach this. So Justin has to be here for me to get fluid. Once they're turned off, I do need to like clamp it, otherwise blood starts going back into the tubing. And just like keep in mind, if you're getting fluids, you have to keep the bag above you, I guess above your heart, because a couple of times I've taken the bag off and like set it somewhere for just a second and it starts filling with blood. So that kind of freaks me out. Blood doesn't freak me out, but when it's like your own, I don't like it. So I'm just extra careful with that. Those are all the meds that I'm on, just to give you kind of an idea. One thing I wanted to talk about was we got this off of Amazon. This is for you to be able to take a bath or a shower. So what I do is we disconnect the Zofran whenever I take a bath, and your arm just goes in here. It's a little bit tight. I did notice, it took me a little while to notice this, that one of the holes is smaller, so I use the bigger hole obviously for the bigger part of my arm. I think I was doing it backwards for a while. It's not super comfortable, but it does keep the water out. The home health company had sent me like some bags, kind of. It's almost, it had fingers cut out, but it didn't keep water out very well at all. So this one that we got on Amazon works so much better. Use it every time that I take a bath, and I'm gonna try to maybe use it whenever I go outside with Mackenzie. I'd like to sit in the pool with her for a few minutes possibly. So if you have something like that you want to do, I mean, be super careful. With Piccs, there's a high risk of like infection, so just make sure that you're really clean and just be super careful with it. But this helps so much. I will link it in the description. I'm very glad that we bought this. If you've been following my journey the whole time, I had a PICCLINE over here to start with. There's still a little bit of a scar, and after having the Picc for a couple months, I started having a reaction to the adhesives, the securement devices. So what holds the Picc in place, like the Picc is placed in there and then it's very long, it goes up towards your heart. But this kind of thing, this is kind of like typically what a securement device looks like. So it's sticky on one side, and then this side, the Picc tubing like kind of snaps in, so it clicks in. So this is kind of what typically they use. So my body all of a sudden started not liking that, started developing really bad blisters, and they like opened up. So my arm was always like oozing. It felt like it was burning. They kept moving it around. We tried a couple of different types of this, any kind of securement. Now at this point, even Tegaderm, which a lot of people use Tegaderm for IVs and different things. Even Tegaderm, if you put it on my skin right now, I start getting those blisters and it starts burning. So I'm gonna have to be really careful whenever I'm in labor that they don't use a whole lot of adhesives. The doctor thinks that it's just because of maybe my hyperemesis and being pregnant. I'm really sensitive to it right now because I've never had issues with Band-Aids or anything like that before. So the blisters became such a problem and they became so bad that I had to get it in the other arm, and they sutured it in so that I don't have to use one of these anymore. So instead of having this, I just have 2 stitches keeping it in, and then we wrap it with Cobian, which a lot of places use this if you like give blood, and then there's a piece of gauze. So it's a piece of gauze and Cobian that's covering it just to keep it sterile and keep it in place because it does hang down. So I don't have the blisters and everything, but because of the stitches, it kind of gets like pulled on just because it's heavy. And if I put more Cobian around my elbow, the Cobian's not super comfortable. I don't know if you can see that, but like it starts digging into your skin. So it's not comfortable at all. So I like using less, even though it is kind of pulling on the PICC a little bit. I also started having an issue with some of the cleaning stuff they were using, so I can only use the dressing kits that have the betadine, and she just puts betadine on it, lets it kind of like soak into my skin, pats it off a little bit, and then we just wrap it up. And we've been doing it 2 to 3 times a week. Pretty much, it bothers me every couple of days. I'll feel like it's getting a little bit more comfortable, and then it starts bothering me again. The last couple of days, it's actually like the skin around it is kind of like getting hard. Really hope that that's not meaning that it's like going bad. I really would hate to have to get another one in the last 6 weeks of my pregnancy. I'm really hoping we can just make this one last. It feels a little bit better today than it did yesterday, so we'll see. I am going to show y'all what it looks like real quick. Make sure that you or whoever's helping you uses gloves whenever you're doing anything with your PICC. If you're going to be actually like cleaning it and like touching near the site, you know, they need to be using the sterile gloves and like sterile process. You know, it comes in, the sterile gloves come in a kit. But I'm just going to undo it for y'all to see. I'm not going to like mess with it. So I just have regular gloves on. So even though I work in the hospital, I never knew like how uncomfortable and like what a big deal it is to have a PICC. Like I never understood, you know, what some of our like CF patients go through when they have PICCs and stuff. It's way worse than I ever expected, to be honest. The meds that I get through the PICC are so worth it because it makes me feel so much better. I don't know how I would have survived or the baby would have survived if I didn't have the PICC, but I didn't think that it would be very painful or much of a pain to have. I think I'm a special case because I've had issues with it, you know, with the reactions and everything. So typically it shouldn't be like this big of a deal. So I'm going to show y'all what it looks like. It's kind of gross, but I would have liked to have seen this. So if you don't want to look at it, turn your video off now. If you do, let me show you. Mine always looks kind of gross and scabby, and it has like a yellow tint to it because of the betadine that she leaves on. She just lets it air dry, so that's why it kind of looks yellow. So this is the gauze that's on it. And then we pull it back. Another thing that's happened to me recently is underneath, like this whole part, I'm not going to touch it, but underneath this part is getting like a little bit of a sore under it. So we actually have another piece of small gauze under it now. We just started doing that this week because last week it was really hurting me. It's got some scabs. There's the 2 sutures. They're in there with that little circle. And then it stays in with the sutures. This is just to like keep it sterile and covered. And then like I said, if I didn't have it wrapped, this would be pulling down. So when we wrap it, I just have to make sure it's like lined up right. But that's what it looks like. Not too pretty. Like I said, this is all the betadine that's on there. It's not like oozing or anything like that. And it always looks kind of pink and mad. But this actually looks good for me. It's much better than it usually looks. I think that they kind of did the stitches a little bit off because it's pulling to this side. They don't line up quite right. I think if they'd done the stitches a little better, I wouldn't be in as much discomfort as I have been. So anyway, that is the pick. The last tip that I did want to share with y'all was, so after the filter, we have the clear microclave. It's just a little piece that we added in. So it's added right after the filter. It makes it where I can take apart those two pieces and clean it really good, and I can give myself the 4th dose if Justin's not here or if it's in the middle of the night. So we've been doing that, and it also makes it where I can change clothes without him being here, because before we did that, I couldn't give myself any meds and I couldn't change clothes because I couldn't disconnect it. So it's been really helpful. I wish that we would have known that sooner. The meds do go through the filter, so I mean, I'm still getting them, but I feel like it takes a little bit longer. So anyway, I hope that maybe those things about my PICCLINE give somebody some information like I wish that I would have had. If y'all have any questions, let me know. I'd be happy to share anything else with y'all. Thank you for watching. Please subscribe.